Okay, so we're on the last section of our chemical abuse learning plan. And we are going to focus on cannabis, which is marijuana, inhalants, and tobacco. So let's start with cannabis or marijuana. What's important to know with this is that really this is the gateway drug. So this is usually where people start and then they progress to the more severe drugs of abuse that we've already talked about. So cannabis is marijuana or hashish. Marijuana is produced or comes from an Indian hemp plant. Okay, and the components within the hemp plant the active component, excuse me, I'm stuttering, is called THC, tetrahydrocannabinol, and that is the active ingredient found in the resin secreted from the flower tops and leaves of the cannabis plant that is used. So common names for cannabis: pot, weed, herb, grass, or reefer. Okay. Another substance that I want to bring to your attention is called K2, or sometimes what they call spice. And what this is a synthetic marijuana. Usually it's smoked and it has somewhat of a clove smell to it. K-spice is it has been found to increase agitation, sweating, seizures. That pain threshold is they feel no pain whatsoever and have spastic body movements. Again, they may have some paranoia. K2 or the synthetic marijuana can last from 1 to 8 hours if taken. So here are some statistics for you. Again, the routes of administration they're smoked or they may be vaporized. The smoke may be vaporized and inhaled through a pipe or a bong. Okay. It also can be ingested. Now, marijuana, there's been some debate as of late. You probably have heard this on the news, but there have been 4 states that have actually legalized marijuana, and those would be Colorado, Washington, Alaska, and Oregon. Okay. Therapeutic uses, they have found that there are therapeutic uses for marijuana. Again, medical marijuana is legalized in 20 states, not Wisconsin, and the only approved THC preparation is called Marinol, which is used to control nausea and vomiting resulting from cancer chemotherapy treatment. So Marinol is also used to stimulate appetite in clients with HIV AIDS syndrome. Okay. So what is the biochemical effects of marijuana? Well, it's the THC, which causes the psychological hallucinogenic properties. And it can vary depending on the plant that it came from. Okay, when smoked, its effects usually occur within 20 to 30 minutes and may last up to 7 hours. Because THC is stored in body fat, its elimination is very slow. So the half-life for marijuana is anywhere from 2 to 7 days. And the longer a person has been using, the longer it is to get out of their body, just for this reason. So the psychoactive effects are again depends on the dose that they take and the plant that it comes from. So expectations from the user outside of the drug setting is difficult to determine. But low to moderate doses will cause euphoria and that relaxation, some sensory perception alteration, and distortion of time. Now at higher doses, they're going to have more symptoms such as intense anxiety, delusions, paranoia, and psychosis. Intoxication of THC is going to cause paranoia, panic, hallucinogen-like psychotic states, okay? People can build up a tolerance. So when taken in extremely high doses, marijuana can produce tolerance and physical dependence. So withdrawal and treatment from THC. We rarely see people seek treatment for marijuana. The side effects of withdrawal are just not that severe that people usually seek any kind of assistance with that. So individuals using marijuana, if they do seek treatment, it may be because of that anxiety, the mood symptoms, the psychosis, and the or perhaps the toxic reaction to a combination of drugs that they've taken. So a treatment is going to be directed at relief of their symptoms, and the administration of drugs is typically avoided if possible. There is no antidote for marijuana and or substitute therapy for marijuana at this time. So withdrawal signs and symptoms are going to be just acute reactions, that intoxication, mild, it's usually mild and time limited, and complications usually do not occur unless they've taken it with other drugs such as heroin and cocaine. So basically we're going to be trying to treat their anxiety, educate them, and refer them for sustained rehab. Okay, so let's move on to inhalants. Inhalants, or huffing, usually occurs with solvents, glues, or aerosols. You can see the current impact that it's having in the statistics on your screen. Sometimes huffing is sniffing of very volatile solvents such as spray paint, glues, cigarette lighter fluid, any propellants that are found in aerosol cans. I even have seen teenagers inhaling the propellant from, say, the whipped cream cans that you can squirt on things. I mean, they're inhaling the propellants even in common products such as that. So inhalants are maybe an early marker of other substance abuse, and the focus should really be on increasing prevention efforts and early diagnosis and treatment. Inhalant is the major route, is from common household items and industrial solutions. It can be sniffed, huffed. Sometimes they'll put a bag over their head and spray into the bag and then inhale it that way. The four main classes of inhalants are solvents, aerosols, anesthetic agents, and nitrates. They all act on the central nervous system as a depressant and can cause extreme damaging effects to the heart and respiratory system. So here is another nice picture showing you all the effects. People who are, it's usually teenagers, but it doesn't always have to be. It can be older adults also. But people who use inhalants will develop peripheral neuropathies, exhibit tremors, and weakness. Sudden death can occur from the direct toxic effects of the things that they are inhaling. Sometimes they may lose consciousness, and sometimes they'll die from aspiration of the gastric content. Since they feel no pain, sometimes death occurs just related to risky behavior and trauma. Obviously, suffocation is a huge risk with this group. There are no antidotes, and treatment is purely treatment of symptoms. Okay, so tobacco. Smoking cigarettes is the most dangerous method of tobacco use. as compared to other things like oral, what's the word I'm looking for? The oral tobacco form. And the reason that cigarette smoking is the most dangerous is because cigarettes contain over 4,000 chemicals and include about 45 cancer-causing agents, and that can cause long-term effects. Nicotine passes freely into breast milk and is toxic to nursing infants already. Also, we have all received education since we were in grade school about tobacco, and this is one of the biggest public health efforts that you can probably put your finger on is tobacco use. And you're seeing more and more restrictions put on tobacco, such as bars not being able to smoke in bars anymore, not being able to smoke in restaurants, having to go outside, and things like that. So the biological effects of nicotine are on the neurotransmitters acetylcholine and dopamine. Okay, withdrawal symptoms may occur within a few hours from stopping smoking, and typically will peak within 24 to 48 hours, last weeks. After withdrawal subsides, the person is still going to struggle with that cue-induced cravings. So going out with their friends drinking, that may have been a time that they always smoked. That's what we mean by cue-induced cravings, and will precipitate the relapse of people to smoke again. Here again is a picture of the side effects of nicotine. Nursing interventions. So main interventions is that we are going to, build that support system for that person and do teaching, okay? A support system that is quite frequently used for smoking cessation is Quitline. So perhaps you've heard of that, where the person can call in at any time that they're feeling the craving to smoke and get support to abstain from that activity. As nurses, we're going to want to teach them about nicotine replacement systems. We're going to have the client actually sign a contract with us, set a quit date. We're going to help them choose which replacement system is going to be best for them. Identify what those triggers are that's going to precipitate a relapse into smoking. And then again, those support systems to support them through the process. This slide just gives you some nicotine replacement systems that are typically used when somebody is trying to abstain from smoking. And I just wanted to point out that with the gum, it's really important to teach the patient how you should really use it. And that is that they chew the gum for 30 minutes and then they pocket it in their cheek, between their cheek and their gums, and let it set there. Continuous chewing of the gum is not going to have the effect it will is if they pocket it and let that absorb through the mucous membranes. Okay, so that's one important aspect regarding the gum. Nicotine replacement therapy should not be used with pregnant or nursing women. Smoking while using the nicotine replacement therapy can actually cause a nicotine overdose, so that is another teaching point that you're going to want to be using with your patients. Tapering off of agents is acceptable, except when they're using the transdermal patch. Okay, replacement agents is basically just a personal preference, whichever route they want to use or they think will be effective or easiest for them. A common excuse of people that I hear who are trying to abstain from smoking is that they can't do it because of the cost of these nicotine replacement systems. A box of patches can cost up to $60. So that is often an excuse that I will hear. Now there are, insurance companies will cover nicotine replacement systems sometimes. Sometimes they can get these at no cost through cessation programs offered through their county. And then finally, if they can't find a source to get the medication paid for, what you say to them is think about what you are spending on cigarettes every week, and then think about what the replacement system costs. So maybe you're spending $100 on cigarettes every week, and the box of patches is only going to cost you 60. You're actually saving money, and in the long run, once you quit smoking, you won't have a cost at all because you'll be done with it. So that might be a way to put it to them. Okay. Um, the nicotine replacement systems are uh, they're dosed. So that the more chronic heavy smokers, you're going to be wanting to put them on a higher dose initially and then taper them down. Medications that we use sometimes to help with smoking cessation. One is called Wellbutrin, which is actually an antidepressant, and it is thought to, the mechanism of action is really unknown, but it is thought to inhibit that reuptake of dopamine, and to a lesser degree norepinephrine, which reduces the urge to smoke and assists decreasing those withdrawal symptoms. Wellbutrin can be combined with other nicotine replacement systems to get an added bonus. Wellbutrin is marketed as Zyban. You might have heard of it talked about in that way. Another medication that has been used quite a bit, it's newer, is the Chantix, okay? This is an alternative, to the nicotine replacement therapy or the Wellbutrin. And how it works is it is an antagonist of the nicotine receptor, okay? So it reduces the cravings for nicotine and decreases the pleasurable effects if they smoke the tobacco. Treatment with Chantix is typically 12 weeks. Most people are successful in quitting smoking when they use the Chantix plan and have a better outcome in the long run, meaning that the use of Chantix has been shown to decrease their incidence of relapse, or you know what I'm trying to say, right? The drawback to Chantix there's been high incidence of mental health issues related to this medication, especially if the person taking it has a history of some mental illness. It seems to increase symptoms of bipolar, schizophrenia, and anxiety. So as nurses, we want to be screening patients prior to being put on Chantix for any mental health disorders. And what it has been shown to cause is panic. 15% of people have abnormal dreams. 20% of the people have had insomnia. There has been depression with increased suicidal ideation. There has been psychosis and agitation and aggression. So this medication as a smoking cessation tool needs to be used carefully. Okay, that ends our lectures for substance abuse. Congratulations, you made it.